Well, my background is a board-certified infectious diseases specialist, 15 years of clinical practice, and I do see patients as an infectious disease specialist. I also am the chief medical officer here at the hospital, although the opinions I'm expressing are my own, not reflective of the hospital. Antibiotic resistance is, I think, one of the most concerning developments in all of medicine for public health. The impact that antibiotic resistance has had on our patients is that it has caused patients to die of infections that we should have been able to treat, or if we can treat them, we have to treat them more intensively. They may get more side effects. We may have to treat them intravenously for a long-term IV catheter rather than be able to give them oral antibiotics, which creates all kinds of other risks to the patient. I think we have reached the point of sort of 6 degrees of separation. Most people know someone who was affected by an antibiotic-resistant infection. And it's an abstract concept up until that point. But when you've seen a loved one or a friend suffer or die from one of these infections because we're running out of antibiotics to treat them with, it brings it home. And when that happens, people start thinking, wow, this is not a theoretical construct. This is actually hurting people. That's not good. Why are we allowing that to occur? In order to understand the seriousness of the threat that antibiotic resistance causes, you have to understand how important antibiotics are. Right? Antibiotics have caused massive reductions in death across a variety of types of diseases and have enabled a number of different life-saving medical practices. We would not have cancer chemotherapy, complex surgical management, intensive care unit, organ transplants, care for premature babies, if we didn't have effective antibiotics. As you lose the antibiotics due to resistance, it threatens all of those medical advances. In order to understand what's driving antibiotic resistance, one needs to understand what an antibiotic is. An antibiotic is simply a poison that kills bacteria. And since the bacteria actually are the ones who invented those poisons, antibiotics were invented by bacteria to kill off their competition. They also invented resistance mechanisms to protect themselves so they wouldn't kill themselves as they were making the antibiotics. They've been doing this for about 2 billion years with a B. And so anything we come up with, they're already going to have a resistance mechanism too. What causes the resistance to emerge is natural selection. When I start killing bacteria with an antibiotic, the susceptible ones die off, leaving behind the ones that were already resistant to now grow and spread. That is what causes resistance to emerge. One thing people need to understand is that all use of antibiotics selects for resistance. Even appropriate use of antibiotics does select for resistance, but we need the appropriate use to save lives. So our only opportunity to reduce resistance is to eliminate unnecessary antibiotic use. And since most antibiotic use is unnecessary, if we can eliminate it, we will greatly slow the spread of resistance and prolong the useful lives of these life-saving antibiotics. I think people are surprised when they learn that about 70% of the antibiotics sold in the United States are put into animals, not people. 2.5 times the amount that go into humans to treat disease goes into animals. And the vast majority of that is not to treat sick animals. Nobody's complaining about treating infected sick animals. The vast majority is used to growth promote livestock. And as people have complained about growth promotion, the people using the antibiotics have changed the name to prevention. Right? We don't prevent infections in people with antibiotics. Why would it be acceptable to prevent them in healthy animals? That is a gross misuse of antibiotics. People ask the question, how much of the resistant infections in people can be attributed to antibiotic use in animals? CDC has estimated 20% of human-resistant infections can be linked to animal agricultural use of antibiotics. I suspect the number is probably higher. But the real answer is it doesn't matter. It's not zero. It's unequivocally not zero. We know antibiotic use in animals contributes to resistant infections in people. The question is, why should we as a society accept that a small group of people think they will make more money by harming people by causing resistant infections? And when you pose that question to the general public, their answer is, I don't think people should be making money by causing any resistant infections in people. The solution to antibiotic use in agriculture is awareness, because as the public starts to learn, hey, when we use antibiotics in livestock, it can hurt people, they will increasingly demand antibiotic-free meat products. And that will help businesses understand our customers are asking for a move into this market segment, the antibiotic-free meat segment. That's what they're asking for. We should give them that. That's in our best business interest. The alignment of market forces with public good is something you don't see very often, but we have it here. So awareness will help us drive that alignment. What can the general public do to protect themselves from antibiotic resistance? Number one, wash your hands. Okay? Antibiotic-resistant bacteria are often spread by physical contact, and that includes in preparing food. Number two, cook your meat and wash your vegetables. Number three, live a healthy lifestyle so you stay out of the hospital. And number four, seek out antibiotic-free meat.